Welcome 2522 class. Today we are going to be talking to you about the pathophysiology, signs and symptoms, diagnostic tests, nursing interventions, and complications of deep vein thrombosis, or DVT. Let's start off with pathophysiology. DVT is caused by a thrombus in a deep vein. In the middle drawing, there is a normal leg which shows valves that assist with blood flow and help to return blood to the heart. However, in the drawing on the right, it has DVT. There is thrombus occurring within these veins, interrupting normal blood flow. A thrombus is made up of red blood cells, platelets, and fibrin. This is most commonly seen in leg veins such as popliteal and femoral veins, but can also occur in pelvic and arm veins as well. There are three causes of deep vein thrombosis, which include venous stasis, endothelial injury, and a change in blood coagulation, more specifically hypercoagulability. These three causes are referred to as Virchow's triad. Different diseases and conditions leads to one or more of these causes, and this will predispose one to developing DVT. Now let's move on to signs and symptoms associated with DVT. When DVT affects the legs, common symptoms include swelling, cramping, warm skin, tenderness, and a reddish or bluish color over the affected area. Swelling and pain may also be felt on the shoulder, neck, arms, and hands, as well as weakness in the hands. Pulmonary embolism is a major life-threatening complication of DVT. Symptoms of PE can vary and largely dependent on the size of the clot. Common symptoms include chest pains, dyspnea, mental status changes, respiratory alkalosis, tachypnea, and restlessness. A large clot may cause shock and lead to death. Complications of DVT. As mentioned previously, PE is a life-threatening risk caused by DVT. A thrombus can dislodge from deep veins and become an embolism. The embolism can then travel up to the heart via the inferior vena cava. The heart will pump the embolism to the pulmonary circulation, where the clot can block the pulmonary artery or its branches. It has been found that 90% of PE originating in legs or pelvis may lead to death. Another complication may be venous ulcers. Venous ulcers may occur after acute DVT or chronic incompetent valves in deep veins, causing some symptoms such as thickened skin, swollen veins, and petechia. Risk factors for developing DVT essentially will fall into one or more of the Virchow's triads categories. These risk factors include pregnancy, because when the uterus enlarges, it can press against the inferior vena cava, causing stasis below, and also an increase in clotting factors during pregnancy. DVT may be caused by inactivity, body position, and pressure resulting in venous stasis and decreased perfusion. Hospitalized patients who undergo surgery or who are in post-operative recovery are also at risk. Others include older adults, obese patients, and those who are immobile and bed-bound. Diagnostic tests. In order to diagnose DVT, the veins and the clots can be visualized by a venous Doppler ultrasonography, duplex ultrasound, venography, and a CT or MRI can be performed. Along with a physical, health, and family history, a blood test would be conducted to identify if D-dimer is present, which detects proteins in the blood when a clot begins to break down. A positive test result is indicative of a clot. Nursing, treatment, and management. A Wells score test can be completed if a person is suspected to have DVT. This contains a series of criteria that helps determine the probability of a client in developing or having DVT based on symptoms and characteristics. Therapeutic interventions to prevent DVT are anti-embolism compression stockings and physiotherapy to promote circulation and blood flow, as well as anticoagulant medications such as heparin and warfarin. That's it for now. Thanks for watching. We hope this helped expand your knowledge of DVT.